Rosuvastatin is used together with a proper diet to lower bad cholesterol and triglycerides in the blood and to increase your good cholesterol. It is also used to treat adults who cannot control their cholesterol levels by diet and exercise alone. Rosuvastatin may help prevent or slow down medical problems, like atherosclerosis, hardening of the arteries that are caused by fats clogging the blood vessels. It may also be used to prevent certain types of heart and blood vessel problems in patients with risk factors for heart problems. This medicine is available only with your doctor's prescription. How to use? Use this medicine only as directed by a doctor. Do not use more of it, do not use it more often, or do not use it for a longer time than the doctor ordered. Also, this medicine works best if there is a constant amount in the blood. To help keep this amount constant, do not miss any doses and take the medicine at the same time each day. In addition to this medicine, your doctor may change your diet to one that is low in fat, sugar, and cholesterol. Carefully follow your doctor's orders about any special diet. This medicine comes with a patient information leaflet. Read and follow the instructions carefully. Ask your doctor if you have any questions. You may take this medicine with or without food. Swallow the tablets whole. Do not break, crush, or chew it. Do not drink large amounts of alcohol while using rosuvastatin. This could cause side effects on the liver. Dosing. The dose of this medicine will be different for different patients. Follow your doctor's orders or the directions on the label. The following information includes only the average doses of this medicine. If a dose is different, do not change it unless your doctor tells you to do so. The amount of medicine that you take depends on the strength of the medicine. Also, the number of doses you take each day, the time allowed between doses, and the length of time you take the medicine depend on the medical problem for which you are using the medicine. For oral dosage form, tablets. For atherosclerosis, adults 5 to 40 mg once a day. Children use and dose must be determined by a doctor. For heterozygous familial hypercholesterolemia, adults 5 to 40 mg once a day. Children 10 to 17 years of age, 5 to 20 mg per day. Children 8 to 9 years of age, 5 to 10 mg per day. Children younger than 8 years of age, use and dose must be determined by a doctor. For homozygous familial hypercholesterolemia, adults at first 20 mg once a day. Your doctor may adjust your dose as needed. Children 7 to 17 years of age, 20 mg once a day. Children younger than 7 years of age, use and dose must be determined by a doctor. Contraindications: hypersensitivity, active liver disease, elevated liver function tests, pregnancy, lactation, myopathy, concomitant use of cyclosporin. What should I avoid while taking rosuvastatin? Avoid eating foods high in fat or cholesterol, or rosuvastatin will not be as effective. Avoid drinking alcohol. It can raise triglyceride levels and may increase your risk of liver damage. Some antacids can make it harder for your body to absorb rosuvastatin. Avoid taking an antacid that contains aluminum and magnesium within 2 hours after taking rosuvastatin. Rosuvastatin side effects: get emergency medical help if you have signs of an allergic reaction, hives, difficult breathing, swelling of your face, lips, tongue, or throat. Rosuvastatin may cause serious side effects. Call a doctor at once if you have unexplained muscle pain, tenderness, or weakness, muscle weakness in your hips, shoulders, neck, and back, trouble lifting your arms, trouble climbing or standing, confusion, memory problems or liver problems, upper stomach pain, tiredness, loss of appetite, dark urine, jaundice, yellowing of the skin or eyes. Common side effects of rosuvastatin may include headache, weakness, muscle aches, or nausea, stomach pain.